Good morning and welcome to the September 11th Frank Talks. We're so glad you're here to be part of a conversation about the opioid crisis in our community. I'm Mindy Tate, Executive Director for Franklin Tomorrow, and we welcome you. Tim Murphy, our board chair, is not able to be here today, but we are so lucky to have a great committee co-chaired by Patrick Baggett and Mary Lee Bennett, who are members of our board of directors. And then also a big thank you to Carmen Stanek, our operations administrator, who always does a great job putting together our events and activities. I'm just here to welcome you and remind you that Frank Talks is always the second Monday of the month. And these events are free and they're held at different locations across the community. And we hope that you will mark your calendar now that you've signed up. If you pre-registered, you'll be on our mailing list, and we will notify you of upcoming events and where they'll be and what the topics will be. We know what we're going to be doing in October, but I think we'll talk about that at the end of this meeting because we have a very important topic, and I'm going to turn it over to Patrick and let him introduce our panel and our special guests today. So thank you so much.
Thanks, Mindy. Thank you all for being here for this September Frank Talks discussion on the opioid crisis in our community. Today, we were going to be discussing this issue that you've no doubt heard on the national, local news, and maybe had some personal family experience, friends experience. It would not be a surprise that you would have that kind of close connection with this crisis. But before we get started, I want to introduce two important partners here for this event who we are highlighting. I want them to, instead of me giving a synopsis of what they do and their importance to the community, I've asked them to come up and give a brief 30-second or so spill on what they do. And the first, I would like for Lauren Kissinger to come up from the Healing Housing and give us a little overview of what Healing Housing does.
Thanks. I'm Lauren Kissinger. I'm the Director of Marketing and Development over at Healing Housing. So we are Williamson County's first and only transitional living home and program for women in recovery from drug and alcohol addiction. We provide the next step after treatment for women to help them get back on their feet and return to society successfully. We offer safe housing for women. We offer individual and group counseling, life skills training. We have a required savings and budgeting program. They have individual healing plans, and they work on their 12-step work while they're with us so that after 6 months to a year and a half, they're ready to return and live life with purpose.
Thank you, and thanks for being here and supporting this Frank Talks. And next, Alex Windings, Director of the Williamson County Anti-Drug Coalition.
Thank you for having me. So I'm with the Anti-Drug Coalition. We do prevention of drugs and alcohol. Our goal is to reduce youth alcohol, drug, tobacco rates, so we focus on those different areas. One big thing that we're really focusing on right now, especially with talking about the opioid crisis, is our Count It, Lock It, Drop It campaign. This is a free lockbox that you can use in your home. They're free to anybody living in the county. I have about probably 40 or 50 in my car and out back there, so please take some, and I think I have about 100 at home. So if you want one, please take one today. If you know somebody who might be interested in one, get my contact information, contact us. If you want to be involved with our group, come see us. We can have coffee, talk about more what we do, and thank you for being here. This is a very important topic that's near and dear to my heart, so thank you.
Thank you, and thank you for being here. We would be remiss if we did not recognize that today is a significant day in the history of our country. September the 11th, 2001 was a tragic day, a solemn day, and we want to take some time this morning, since we have convened here, and to remember the first responders, the members of the planes, of the passengers on the planes, who showed tremendous heroism in the face of extreme danger. And so let us, I would like for us to stand and have a moment of silence for the significance of this event and remembering it today. Thank you. And thank you to the first responders, police, and fire who are in the audience today. You guys keep us safe and do it in a selfless and tremendous way for our community. Thank you all for being here. Thank you to Detective Dilworth, who is a Franklin police officer as well. A few weeks ago, I was watching a interview on one of the cable media outlets, and the interviewee was Chris Christie, New Jersey governor, and he's the head of the Donald Trump's opiate task force. And he said something that really struck me. 142 Americans die every day from opioid overdose and addiction. 142 Americans every day. And the comment he made in that interview was, that is a September 11th. This was the comment he made, which was coincidental to the fact that we're doing this on September 11th. That is a one September 11th every 3 weeks in America. It's quite significant. And actually the comment he made was, if we actually had a September 11th every 3 weeks in America, there would be martial law. There would be tremendous crackdowns on with law enforcement. Congress would be spurred on to act. Local and state governments would pull out all the stops. And Chris Christie, and I'm borrowing that from Chris Christie, emphasized the severity of this issue. So how important and how coincidental, providential, what have you, that we're having this discussion here in Franklin on September 11th to mark the severity of this issue. This morning, we're so lucky, though, to have Detective, from right to left, Detective Robert Bobby Dilworth, Franklin police officer. He is a 7-year law enforcement officer, 2.5 years in Franklin. He is a second-generation Franklin police officer. And thank you for being here to shed some light on the law enforcement side of this issue in our community. Next, we have Cindy Blom, who's a certified professional addiction and recovery counselor, and she is in private practice and is at Christ Community Church, also here in Franklin, up on Hillsborough Road, and a local advocate. She is also the mother of Eric, who we look forward to hearing his story today and having Cindy share that with us. And then also Tony Owens, who's the owner and operator of Educare Counseling Center. Thank you for being here, Tony. Tony has also been a part of the drug court here in town in the past and is still an advocate for the work they do. And all three members of our community with direct involvement in hopefully the solution to this issue in our community. Wanted to start out with, and this is the microphone, this is the wireless here. It should be on, and we'll just pass back and forth as fit. But I wanted to just really define what an opioid is. So if Detective Dilworth, will you take that, and then whoever, Tony or Cindy, what is an opioid? For those of us in the audience that may not know what an opioid is, what is an opioid?
The easiest thing I think to compare it to would be like a painkiller or a muscle relaxer. It's a chemical, opiate, interchangeable, that reduces, I guess, feeling in the body that causes pain, things of that nature. You have your stimulants, which put you on a high, your depressants, obviously, which put you on a low, that opiate kind of in the middle that kind of makes you not feel at all physically.
So so when I was looking into this, what are some of the brands that one might see on the opioids?
I mean, some of the street level, and they're not necessarily brands, but heroin, meth is kind of an opiate. It's more of a stimulant. And then you have several prescriptions, which I'm not as familiar with. You were kind of...
Yeah, like any of the... think when you have hip replacement, back surgeries, if you look in cabinets around the county, you will see lots of opioids in the cabinets. So, OxyContin, oxycodone, Lortabs, those kinds of things. It's as old as poppies and morphine. So it's been around. It's been around for as long as we know.
Yeah, thank you. When I think of opiates, I think they're morphine derivatives our system, our brains make morphine naturally. And so these drugs mimic our natural pain endorphins. And that's what sends that false signal that the brain is making too much morphine, so therefore we have a downregulation. When I think of opiates, I think they are classified as narcotics. We toss around narcotics a lot, but the word narcotics is limited to opioid pain medicine. So some of the ones Cindy and Officer Dilworth mentioned, the Lortab, which are typically, the beginnings of an opiate prescription, and then some of the heavier ones. And as many people know, what's happening is our people are getting addicted to the prescription medicines and then going to the cheaper street drugs, which has created a lot of our fatalities. So opioids, there are both synthetic opioids, and then we also have natural opioids that are derivatives, but all from poppy as well.
So what triggers then? So these are very, very powerful drugs. They're all within arm's reach of most of us. If you've had these kind of treatments and surgeries that most everyone has had, they're within arm's reach. What triggers an opioid addiction? And you mentioned that it's a chemical reaction. What triggers? Why are these so powerful in triggering addiction?
Yeah, like I started, what happens again is what we call down regulation. So when our brains are naturally, and I always love doing this analogy, I think everybody's had a hammer out, right? And you miss that nail and it hits the tip of your finger. And boy, does it hurt for a few seconds, right? And then immediately your finger sends a signal up for pain medicine. And that pain medicine, and if you notice, it throbs and it begins to lessen, right? And so because of our natural pain endorphins, that is taken care of. Well, when we have extreme pain, we're fortunate to have these medicines. They come out, so therefore we take these medicines, and our brain, everybody remembers homeostasis from science class, which is to keep the body and the brain into balance. So the brain gets this signal when we're taking these pain medicines that we're making too much morphine, too much pain medicine. So therefore it down-regulates. So what happens is when a person takes these opiates for a certain amount of time, and fairly quickly, within 30 days or so, and then they stop taking those, well, therefore the brain has already adjusted, and therefore they are in pain. And many times, or most of the time, they're not only in pain from their back pain or whatever the initial problem was, they begin withdrawal pain as well. And in order to satisfy the withdrawal, the pain is exaggerated, so therefore they take more pain medicine. So it happens really quickly because of this. So the only way a person can overcome that is to again get to some abstinence and go through some really tough times physically and emotionally, and get the brain back in balance. So that's the real crux of the issue, is the biology changes, brain chemistry changes. And for people who are still with a developing brain, 24 and under, that just changes their whole brain chemistry, which is our main class of individuals that we're losing, are our young people who are still in the developing brain stage. So,
and great points. And so, Cindy, that is I want you to now just briefly tell your story and tell us about Eric, and yeah, please take some time to do that.
Well, thank you. I often start this with a slide behind us with this picture, and I go, we're talking about junkies today. We all know a junkie, and we're going to talk about junkies. And I really try to break the stigma, because that is the very reason that people are not getting help and that people aren't asking for help. A family that's in addiction, when I teach at Christ Community Church, I'll say very few people get meals when their kid is dying of an addiction. Very few people get cared for by the church or the community when these things are going on, and they truly are fighting an illness that wants them dead. And Eric, it was interesting, you know, he would mess around with weed when he was a kid, and at 14 he realized that one of his friend's moms traded him weed for her Lortabs at 14 years old. And he was like, wow, okay. And then she traded her Xanax. And it was much easier to get that on the bus because the kids were just going into their parents' drug cabinets and their grandparents, and they'd take a pill or two here and they'd mess around with it. And that's how easy it is. It's honestly much easier to get than marijuana is because it's just right there before them everywhere you go. So that started a long path. He went into rehab. He had several opportunities and moments of sobriety, which were wonderful for us. It was a gift because we could really see that who he was when he was addicted, that wasn't him. We really got to see moments of where he was. And I bring his art pieces here today because a lot of times people ask me to come and talk about the grief a family goes through after overdose. And I try to tell people that Eric was grieving before he died. And you can see from the one picture where his heart's coming out of his chest. And he was an artist. He graduated from MTSU with a graphic design degree, printmaking, sculpture. So we have lots of his art around that we go through, and he tells his own story. He tells the struggle. And by the time he got out of school, and then, you know, there was no insurance. He didn't have insurance. We really couldn't get him into rehab and afford it. Our finances were tapped. So we did the best we could at home and putting support system around him. He also has some rape trauma in his story. So he would continue to relapse over and over again. And when you talked about triggers, I don't think we understood the level of trauma that he was dealing with. He worked as a confidential informant for Davidson County. He just got in really deep, and it was hard. Then the secrets just kept coming, and you know, we had no idea how dangerous and where he was. We knew that he was using. He was homeless. I would go on cold nights in November, and I would drive down, and he lived in a van. The windows were broken. The tires were flat. And I'd say, come on, you know, Eric, are you ready to come home and try to quit? And he's like, Mom, I can't. I'm not ready, and I'm not going to do this to you. So I'd drive through, and I go, you want to go in a restaurant? And he's like, you know what, I can't stand my own smell. I'd go through the drive-through, and we'd sit there, and he'd say, Mom, you're going to have to leave me here. You know you are. You have to go home. You have to go home. So those were moments and times. And then there were times where he came back home and he was clean, and we detoxed at home. I mean, it was crazy to do that, but he didn't have insurance, and we couldn't do it any other way. So we figured out what we could do and tried to help him. Had wonderful moments of sobriety. He worked with my husband. We own Blum Guitar Restoration. And we are, in fact, I was going to bring guitars today, but we got home so late last night from a trip that I wasn't able to do it. But we're building guitars in memory of him. They're called E.B. Rooster guitars. And we're giving part of the money, part of the profits back to help people like Eric. It's just, even the rehab, when you're doing the 30 days, the aftercare is a long journey. It's just a long journey. And there is so much support that's needed. Eric was clean 6 months, and he went to his doctor on April 1st, and I say to people, you know, I mean, I remember him at 6 months old having ear infections, and I gave him Dimetap, and I think he learned at a very early age, when you have pain, if you take something, it goes numb, and that Dimetap was very different those days. So I think in some ways, when I think about it, I'm like, I taught him about the pain thing. You know, I didn't know what I was doing. That was the rhythm. So his body and his brain probably learned how to be addicted at a very early age. By the time he was 29, he was facing, because he was working as a confidential informant, he ended up working out on his own, which you're not supposed to do. and he got caught, and he was facing 8 years in prison. November 18, 2013, he went into Rutherford County for court and went in to meet the DA, and the plan, he's like, I'm with my parents, I'm living with my parents, I'm gonna work there, I have no car, no phone. And the DA said, okay, I'm knocking it down to a misdemeanor, you're gonna do 90 days in county. And that was like crazy. No attorney, no defendant, no public defender. He just went in on his own. And we thought, okay, you know what? Somewhere in this, God is sparing him from that. So he got out, worked with my husband. It was wonderful. Had an appointment with a psychiatrist and went alone. And I regret that day. An addict will always represent themselves. You don't get a good medical history, let's just say. And I didn't go, and he came home with Klonopin. And I'm like, yeah, that's not good. But 29 years old, you're just kind of, you really can't call the psychiatrist. So we monitored it, handed it to him a little bit at a time. Well, it got to be one day, he took 15 pills in one day. But the reason, he didn't take the pills to be high. He took the pills because of the trauma that was driving it. And if we don't get to those underlying core reasons, we will be putting people in rehab over and over and over again. So therapists, it's a complex injury to the brain, the way the brain reward receptors are, the way the amygdala works, all of that goes into the whole process. And I feel like we may be missing a huge piece for those who continue to relapse. So that day, he was in a bad place, and that night, we had to get him to a place where we felt safe and have him kind of we had the police out to our house twice on that day to do mental health checks. So we had a friend come and get him, and the friend buckled and took him to get heroin. And he used that night, and it killed him. And he was 6 months clean. So the next morning, my friend said to me, how are you work at the church, your parents are really not in the loop on all of this. What are you going to do? What are you going to say? And I opened my phone and looked at Facebook, and my daughter, who was 3 years younger than him, said, worst day of my life. My brother and friend just died of an accidental heroin overdose. And I looked at her and I said, I guess we're going that way. And honestly, from that day on, we've just said, you know what, we will be obedient in telling our story and coming out and answering any questions that anyone has, because this is preventable. This is with the right kind of support, and it's not one size fits all. It's just, you have to just look at what each person needs. And we don't have to have that many deaths. And I would actually like Tony to talk about the whole fentanyl piece too, because that plays big into the 142 now.
So, and we'll get to the fentanyl as another question, but I want to now focus on then Detective Dilworth about from your perspective, law enforcement. And thank you so much, Cindy, for sharing that. That is very brave, and for you to be able to share and to help other people. We appreciate that very much. Detective Dilworth, what do you see on the front lines in law enforcement in our community in Franklin and Williamson County, Tennessee? How do you see this addiction or this epidemic taking shape in our community? We've heard the personal side, but from the law enforcement side, what are you seeing?
We're lucky to live here in Williamson County, Franklin. You look at Metro Nashville, they have 2, 3, 4 shootings a night now. Kind of when people say, oh, you work in Franklin, there's no crime, and laugh about it, say, no, we have the same crimes that Metro has, just on a much smaller scaled down proponent, which is good. And that goes directly with the drugs. The drugs are here. Unfortunately, fentanyl's here, heroin's here. Not on as much of a wide scale as your big inner cities, but it is here. Franklin, you have a little bit more of the prescription abuse because the money is here. Williamson County is wealthy, so money has never really been an issue for a lot of people. That's starting to change a little bit with how the pills, for example, your standard pain pills are going for about $1 a milligram. So if you have a 40 milligram pill of OxyContin, that's $40. Your Opanas and your morphine pills are going for $2 a milligram. So they are going up a little bit. You're starting to see a little bit more heroin. We've had heroin deaths here recently with the fentanyl. So it's here. It's not as big of an issue with needles as it is with the pills, but the more pills people take, the higher they need, they start turning to heroin. So it is here.
Tony, will you touch on the fentanyl? What that is,
Yes, I
and
can.
is it here?
Yes, the fentanyl is obviously for late-stage cancer and some of these extreme pain situations. It can be up to 300 times as powerful as some of the other opiates we've talked about. Obviously, what we're finding is a lot of the heroin is being laced with that. A lot of this comes from China. It's low grade. It's synthetic, so it's been produced chemically in labs that aren't typically medical. I'm not sure exactly about the distribution. I'd like to know how that's coming. All I know is what I've heard about the China source, and obviously out of Mexico. So the fentanyl, our individuals who are doing the heroin, they don't know what's in it. And so they overshoot the mark. And, Cindy's story is all too familiar for us that work in the field, and some of you that work in the field, and some of your families. So the fentanyl, is the big issue. But I think more importantly, it's really more about the lapse and that someone has between uses. Our number one person who overdoses is the person who walks out of our county jail over here, followed closely by our treatment center people, because they have that lapse in between use, and then they come back and try to take the same dose that they're used to, and they overshoot the mark. But fentanyl is very likely the cause to many of our overdoses.
And you mentioned, Antonio, I know your history with how does the courts and the treatment and the law enforcement, give us a background of how in Williamson County and Franklin, or there's the special programs we have in place, and tell us about how they interact with the treatment of these individuals that come out of law enforcement or out of.
I'd be glad to. The people that get caught in the criminal justice system are the fortunate ones. They are offered intervention. Here in Williamson County, we've come so far with our courts meeting the treatment system. We have 4 treatment courts here in Franklin right now, which is led by our oldest court. And I noticed Judge Martin's here today, our recovery court. We've changed the name from drug courts to recovery courts, which I'm really glad of that. So it's hard to get used to not saying drug court, but it is it's a court that has about 50 individuals who are felony offenders, and many of them are opiate dependent, and they get brought into the court with really good structure. 2 years is a key point of sobriety. It's not the cure, but by the time someone has, it's not by coincidence that treatment courts are many times 2-year programs. So 2 years, the brain chemistry has changed a lot. This is a brain chemistry disease. So our oldest court is our recovery court, and they meet every Tuesday at 5 o'clock. I would invite some of our citizens here to attend that court. It's unlike any court you've ever been to. It's more that a boy, that a girl, keep up the good work. And that continued motivational incentives of, congratulations and pats on the back just adds to the chances of success. Have a couple other courts. We've got our DUI court here in town, which is alcohol related, but we also have several opioid. It's not limited to alcohol, and so we have some opioid people in there who are benefiting from the treatment process. I know Judge Andre is here, and she heads up that court. Then we have a veterans court, which I think everybody knows the problem we've had with pain management and our veterans as well as some of the other medicines. But so we have about 10 people in that court, and Judge Taylor heads up that court. We've got a couple other courts in the works right now, a mental health court that Sheriff Long has been very strongly advocating for. And then lastly, we are trying to start a new program that's not a treatment court, but it'll be in general sessions, and Judge Andres agreed to help with that. And it's going to be more of a prevention court. So we're hoping to catch some of these people that are smoking marijuana and drinking, and we're really going to go heavy on prevention of opioids. And so I'm really excited about that. The district attorney is on board with that. It will really be more of a intensive probation. It'll be a short-term court. So a lot of the young people who are just getting in the criminal justice system, we're hoping to intervene, early intervention for them. These will be people who are not chemically dependent, but are beginning their journey into substances. So, you know, those are some of our treatment courts here in Franklin. Also, our judges are very, and our district attorney, they request alcohol and drug assessments for many of our offenders, which is another opportunity for intervention. So our court system here in Williamson County is working. It's doing what it can to change lives, and I'm really excited about the cooperation that our court officials are giving compared to when I first started in this thing. Of course, the problems got worse and the courts have adjusted, you know, accordingly. And not to mention our juvenile courts, which I know we've got some staff here from there. So across the board, our courts are working and doing their part to try to intervene. So.
Thank you. And Detective Dilworth, along that, still kind of staying in that realm of law enforcement treatment, what from a law enforcement perspective, how is Franklin Police, or how are Franklin police officers playing a part in the solution? And we want to put the bad guys behind bars, but we want to help those that are truly sick. And what kind of training or what's the message that Franklin Police Department has for the community on how the police department is going to approach this crisis in our community and some of the things that Franklin Police is now doing?
Sure. First, I look over here at the white box on the table. Every officer in the department has been issued a 4 milligram packet of Narcan. Basically, that is a reverse on the opiate effect. So if we roll up to a medical call or somebody that's unconscious, if we have reason to believe that it's related to opiates, we can give them this. If we're wrong, it's not a big deal. This is an opiate blocker. So if you don't have any opiates in your system, it's basically like putting water in your nose. So it only helps. Everybody has to go through a training course in order to receive this. Those couple of seconds before the fire and EMS guys get there could be huge with that. I think Tony said it great. The ones that get arrested are the good ones, are the lucky ones, not necessarily good ones. It's not a stigma of getting arrested. Once you get arrested, we can offer you help in the court system. They can make sure that you're getting that help. If you don't get arrested, there's nobody there to guarantee. There's not a judge there, a district attorney there to guarantee you're getting this treatment. So you're kind of out there on your own. Again, with the mental health court, I know this isn't about mental health, but there doesn't need to be a stigma. Before, I worked at a different agency before I came to Franklin, and we had a mental consumer that stabbed his father to death. The family knew this person was ill. They didn't want to call the police because they didn't want to have him arrested. Had they called the police that day, and they even sat down about an hour before the stabbing occurred and decided they weren't going to call the police because of that stigma. Had they called, we possibly could have got him the help that he needed. I know some places are passing laws that if you're called to a medical scene, you can't charge people if there's drug paraphernalia there. Again, it's not about the charge. If we don't charge, there's no consequences going there. They're going to do it again. They've got to have that stability. And with Eric's story, when the stability was there, he did better. As soon as you release these people, they get better. they're mad at you when you put this Narcan in their nose because you took their high away. I'm not sure if Cindy or Tony said it, but people aren't themselves when they're on opioids. So once you take that high away, you're probably going to be fighting them. And then if you just release them back, they're going to go do whatever they can to get to that high. So the stigma needs to be taken out. And that's, for family, don't be afraid to call the police to your house. We probably could have saved the dad that got stabbed. And it's no different than with drugs.
Thank you. And that brings up a good point. And Cindy, it was a question I had thought for you, but there are misconceptions, and we've touched on a lot of this, but there are misconceptions about abuse. What ways are you seeing effective in fighting that those misconceptions about opioid abuse? Things that have worked, things in our community that you've seen that fight that misconception, any misconception on opioid addiction that might be preventing someone or a family or a friend from going the route that Detective Dilworth just mentioned. What are some of those misconceptions, and what do you see in the community that Franklin is doing or Williamson County is doing or should be doing to help fight that?
Well, this is a big thing right here. This is huge that you're talking about it. What Tony said about describing what's happening in the brain when somebody is addicted, and then you add the trauma piece to it, and then you add a co-occurring mental illness. It's a very interesting mix, and most family members don't really even understand all that's going on. We didn't for a good portion of Eric's addiction. We probably just focused only on the sobriety piece, and then we didn't realize that what was driving the use was really the trauma and the various things. So, there needs to be resources. I'm thankful that we have the recovery court and that we have all of these other things. I call out to churches to say, you know what, you resource your people before they get there. So the prevention, before you even get to juvenile prevention, is to call for the community and the churches to help. And that's the biggest thing, is most people aren't talking about that there because there's so much shame around it. And there's judgment about parenting, and there's judgment about all of that. And that's why we speak up, because I was talking to the people from the Healing Housing, and I said, the other thing is it's easier to get women cared for and to raise support for a house for women. It's harder for the men, and there's more guys. We're losing a ton of guys in this age group, and we have, the society kind of goes, man up, buck up, do it. And if you have rape trauma and you're a guy, you're never going to talk about it. It's not going to happen. And then you don't know what's driving it because they don't talk about it. So we have to just really be able to get open about what's driving it. And so I think those are part of the stigma things, is that we think that they just want to get high. Some people do. They're easier to recover because they can, you basically retrain them. But unless we're dealing with some of the other mental illness things, it's a rough road.
Have we seen, Detective Dilworth, heroin becomes a cheaper substitute than for some of these pills? Have you seen statistically, and maybe you don't know the statistics off the top of your head, but an increase in heroin in Franklin and Williamson County? Is heroin here or back? Tell us about compared to maybe 10 years ago. Is heroin more predominant?
If I say statistics, I'll be lying. So we'll put that out. And but yeah, it's definitely, I kind of hinted on it earlier. Probably 10 years ago, it was more prescription drug abuse. It was easy. You could go to a pain clinic, say your back hurts. You walk out with whatever medication you want. You can drive a mile down the road, go to another pain clinic. And there were people doing that up and down the interstate and giving those pills out. So the DEA kind of cracked down on the pills. Pill mills is kind of what they're referred to as. So it is harder to get the medication, but kind of what I said earlier, Williamson County, the money's here. If you got money, you can get what you want. On the other end, you do have your more street-level users, kind of what I like to call them, that don't necessarily have the money. So the heroin is here for them because they don't have, it's a third of the price as pills to get the heroin. And then there's more supply for the heroin because the dealers that think they're chemists and they're not are mixing this fentanyl in. So you can quadruple your money by mixing a little bit of fentanyl in. You can get 4 or 5 times as much product to sell for the same amount of money by a little bit of fentanyl.
I think the other thing people don't realize is that sometimes the people who are entering in using marijuana and weed, they sometimes switch to the pills because it stays in their system not as long. So if they're in a probation situation or they're being drug tested at work, they can use the pills and it's out of their system and it's killing them. I mean, it's really hard. We had a couple that we just loved cleaning our house. And Eric was back home living at our house, and my daughter had a broken back, and she was legitimately prescribed opiates for the back pain. Well, she was always missing a couple. So, yeah, it was real great drama because she was certain that it was Eric stealing it. Well, he died, and she was still missing him. I ended up finding out and calling some other people, and they were stealing meds she was stealing meds from everybody that she was cleaning houses. She lost every one of her clients that day. She wanted me to help her, and I said, I'll help you get into rehab. I'm not going to help you get other places because you need help. So that's where Alex's lock boxes and the drop-offs, I don't think people realize that when you're no longer taking what you were prescribed, bring them to the drop box and get rid of them.
Tony, this is a question that I think that you might be, hopefully you can answer. It's what role do physicians and pharmacists in this issue play in slowing and stopping the spread of the addiction? And is there anything in Williamson County that is happening that you might allude to in that vein?
Yeah, I'll speak to that just one second. I wanted to follow up with Ray a little bit about stats. You know, we lost 23 overdoses in Williamson County in 2015, and about 80% of those were opioids. There was a great article in Tennessean just a couple of weeks ago that had the rates of death, and we were right up there. So, when I first got in this business 10 years ago or more, I really thought heroin was behind us, man. You know, I mean, we think about the 70s and a traditional heroin addict, I thought heroin's something I'm not going to have to worry about, and I just was shocked as it came back on the scene. But, talking a little bit about the federal government has been very active in trying to intervene in this situation. And so one of the tools we have is what we call medical assisted treatment. And medical assisted treatment does not come without controversy. Medical assisted treatment, by definition, is the use of medicines in conjunction with counseling in order to treat opiate addiction. We have 3 federally approved medicines right now that are approved. Methadone being the longest one we've had for many, many years. I think most of you are familiar with that. It started back when I thought heroin was going to go by the wayside in the 60s. Methadone is traditionally considered a harm reduction. Methadone came on the scene mainly for public safety, where heroin addicts were leaving their needles in the park, and innocent children were stepping on them and contracting diseases and illnesses. And so methadone became a tool to protect the public, but also prevent deaths. And it's a good medicine. It's used. There's a certain population that benefit from that, and these people are their lives are manageable. They work, their fathers, their mothers, when this program is used correctly. We have, these are called treatment opioid centers, and they have to be licensed, and they're strongly regulated. Some of you may be familiar with those. So, methadone is, again, a controversial medicine like all these medicines. But for some people, it works, and it works well. The next one we have is buprenorphine, which came in 2004. And buprenorphine really seemed like it was going to make a big difference when it came out. The way I describe buprenorphine is when we take opioids, let's say these lights are our brain, our opiate receptors in our brain. When we take opioids, every light in the room comes on, ding, 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 ding. That's why we get the euphoria. When someone takes buprenorphine, only about 40% of the lights are coming on, and the other 60% are blocked. So the logic behind that was that a person can get enough medicine that the cravings are satisfied, but the other receptors are blocked. So they're healing. Another way I describe that is like our knuckles are our opiate receptors, and if I sit here and I just tap on my knuckles for 2 years, they're going to kind of get worn down, right? And so that's the same thing with our opiate receptors. So when 40% or 60% of those are blocked with this medicine, they're healing, and so hopefully they would repair themselves. And so the idea of buprenorphine when it first come out was, we'll take this, these people will take this medicine, 2 to 3 months, and that will bridge them over to abstinence, and they'll live happily ever after. And it just didn't work that way. After we found out, research showed that, not any more people were getting clean with buprenorphine that were with abstinence-based programs. But there was just as many getting clean as there were opioids. So it didn't work any better, but it didn't work any less. So there were still a lot of people who were benefiting, but it didn't improve the outcomes. And everything's about outcomes in this industry. So then they pushed it to 6 months and to a year. And now we have people who've been on this medicine for 10 years, similar to methadone, although the medicine is drastically different. Some of the problems we have with this medicine is diversion, which by definition is where people sell it and trade it for other drugs, and the roller coaster ride. They get on the medicine and they get high for a while, and then they take the medicine to keep from getting sick. So, but again, there's still some good that comes from it, because there's days when they're on the medicine, and when they take that medicine, they can't overdose, not at least from opiate overdose. So that's a great medicine. And then lastly, we have another medicine that's really hard to sell to our clients, and that's called Vivitrol and naltrexone. Naltrexone is a daily dose, and Vivitrol is a 1 month shot, which only blocks the receptors. But most people are scared to take that because they think they may have a craving. They don't know about committing to 30 days of abstinence, and not to mention the shot is very, very expensive, and it's about $800. So these are some of the medicines that we've got that are promoted. Again, a number of issues, but I still think the benefits outweigh the liabilities on these medicines.
Thank you. So today, and we'll open up for questions, but I think the main takeaways are that I think Franklin Police Department is doing a tremendous job and on the front lines with issuing each officer this Narcan. It's a very important step. It's a human illness. I think Cindy highlighted that, the fact that this is very personal, and it happens to, and this is one of those that happens to anyone. It's with arms reach from us all. And then Tony, thank you for highlighting the work that we do here locally, the recovery courts and the various courts, and also the medications that might be available for the solution. Yeah, go ahead.
Can I say one more thing? I wanted to talk about our police force. There's not a week goes by that I don't get an officer who refers someone to us. we had someone from the task force just this week who brought someone over, a young lady, and our officers are doing what they can to intervene as well. And a lot of people trust the police officers. They trust because they got a long history with them, and they have feelings too. They have children, and so I wanted to plug that as well. And our sheriff's department also is going to be equipped with Narcan.
Excellent. So we'd like to open up the floor for questions, and if anyone has any at this time.
I wanted to ask, how does, when a potential drug user goes to emergency rooms or goes through someplace, and majority of times the parents have no idea that person is using, how can they be educated? Because they're distraught. They are just taken back. Oh no, this couldn't be my child, or this couldn't be an adult family member. How do they get help and get education and not have the stigma?
Yeah, that is a good question. I think what I have found is that when I'm working with families and with addicts, to treat them like they're humans, to go with them and approach it like, you know what, we're here to fight with you against this illness, and it's not a moral defect, and that they're battling something just like you would if it were a diabetic or if it were anyone else. That's the biggest part. And when there's that kind of neurology of joy, they no longer have any joy with being with themselves. So when people and families know that they're accepted and that they're not going to be shamed and blamed, we were so fortunate. When I was on full-time staff, I would put care teams around people. It's the Stephen Ministry models. I think that we need to train people in churches, and we need to teach people what this is and what this isn't. And Tony's example of the brain chemistry, most people don't know that. And you would never do that to someone who had an illness. It's this dividing the moral character defect away from going, this is an illness. Now, yes, they're making a choice in the very beginning. They're doing several things, and we don't need to just write it off and just scapegoat it and say, well, they're not responsible. Yes, they are responsible. But the way you put care around them, the way you help people is huge. And just know it's going to be much longer than 30 days. When you're dealing with somebody, just with that kind of addiction, it's 2 years or more. And then when there's legal stuff involved, it's, there's just no right answers. We didn't know. Sometimes we bailed Eric out of jail. Sometimes we didn't. And it was usually when my husband and I agreed, we were like, okay, Jesus is coming back because we're agreeing. I have no idea what's going on here. But there's no exact right answer to it. So it's just to be that supportive community, and I think that's when it changes.
I think I saw your hand up.
Question and comment. Are you in touch nationwide with other cities, towns, communities that are battling the same problem?
To some extent. I don't know about the other sides of it. I know we have bulletins that come out more or less about trends. A lot of those are geared more towards first responders as far as safety bulletins. If a department somewhere finds something nobody's seen before, they'll send that out to educate first responders. I know not too long ago, and this goes back to the heroin, an officer got some fentanyl on his uniform. He went to brush it off. He overdosed just simply by brushing off a piece of white on his uniform. So they send things like that out as far as current trends.
The reason I have a comment, we spent the summer on Cape Cod, and we became aware of the epidemic on Cape Cod, Massachusetts, New England, about 5 years ago. We have a friend who is a counselor in a middle school in Falmouth, Massachusetts, and I think the school has about 300 or 400 students. And she said over the past couple of years, she might have 2 students whose parents overdosed, died. This past year, 2016 to June 2017, she had 13 kids whose parents died from overdosing. So, parents need to become aware, and the brain's effect from taking these drugs. There was a young woman on the case who finally was cured, not cured, she was in sobriety. Well, she missed being high, so she just went back to work. So the brain chemistry completely changes, and they don't realize it.
Thank you.
I'd like to ask their opinion. There's a national trend where we're seeing legalization of marijuana in states across our nation. Seems kind of foolhardy when you have a crisis like this. Is that really wise? We're going to see it, I would assume, sometime and try to be put through in Tennessee. I mean, that seems like it's just opening the floodgates to entry.
I like my job, and we're not supposed to give opinions, so I'm going to hand that one off.
Oh man, I knew someone was going to ask this. Okay, I'm not going to probably be very popular in the room. I am just telling you that when my son could use marijuana medically, he was stable and he was able to work and function. I would choose that. Medical, I don't think recreational under any means is an option, but for him, it was something that helped.
I've got opinions, so I have no restrictions other than my wife, and she's given me free rein when it comes to talking about this issue. There's so many mixed messages about marijuana, and I think our young people are most affected, especially here in our court systems. They just get so many mixed messages about marijuana. So, Judge Martin and Judge Easter before him, they ask every single drug court participant who comes in, recovery court, what was the first substance? Where did this all start? And it's 95%, they all alcohol and marijuana. And so, I think there's no blanket, hard and fast rule that includes everybody. Everybody's case is different. My personal views of prohibition, I follow the history. Prohibition has not worked real well. But I go back and forth. I think the problem, if we had legalization, I think it would create some problems, just like the medicine I was talking about, but I think it would solve a lot of other problems. So it's a balance. How are we going to figure it out? I've got my own views. If we could take marijuana, and legalize it, I've always thought, well, what if we just had walk-in detox centers, and take that money and offer everybody free treatment. You just walk in, you go to bed, come on in, go to bed, get well. Would it save lives? I think so. On the other end, the marijuana has changed so much. It's not what I used to smoke. It's so powerful, and I did not inhale. Oh, I did. Yeah. But, it's, it's so much powerful. And again, when we come back to our young people with their developing brains, it's changing their brain chemistry. People who don't smoke marijuana till they're 25, they hardly ever get addicted. It's the other people that are smoking marijuana. So the gateway theory, I believe in it. It's what we experience in the court system. So it's just another dilemma. I don't know if that answers your question, but it's a dilemma. But it's a discussion, but I don't think it will happen in our area, and I hope it doesn't.
Maybe for another Frank Talks, and we'll have some.
One
we can keep, yeah.
real quick thing on that. This is just they're actually putting fentanyl in marijuana now. So there was in the news not too long ago. I'm not going to say my opinion, but when you start anything that's not regulated, if you get it from the street, because I mean, there's fentanyl in marijuana now.
I would be curious to know, aside from the drug courts, what are treatment options, including trauma, for the uninsured population, which are addicted population, many of them are uninsured?
There's the Refuge Center here in Franklin does sliding scale, and they do great work with trauma. Mercy Community Health also does. I tell you, it's almost a 2-month waiting period to get in. Then the needs are huge. It's something that really needs to be increased because there's just not enough resources. But there are places. Brentwood United Methodist, they have a counseling center. There's churches that have counseling centers and various ones around, but it's kind of hard to find. Tony sees everyone for free.
Well, I can, you know, but the state of Tennessee has a block grant which offers everybody treatment. Long waiting list. A lot of people don't want to wait, but every citizen who has a Tennessee driver's license can get a 28-day treatment if they meet criteria. So I think I keep giving everybody pats on their back, but our Tennessee Department of Mental Health and Substance Abuse, incredible job. You know, with all the bureaucracy we have in state government, this is one of the ones that has really gotten better and better. It's that continuum of care that I think you're talking about. It's not there. It's not there, but they can get stable at least.
And we are at 10:30, which is our one more question. There was some in the back that I definitely overlooked. Yes.
You've mentioned a lot. Eric was 14. There's been some mention of the trauma, some mental health. What are the things that are being done in the community to work with the schools? Because obviously we're not hitting them at a young enough age. You're talking about before 25. Where is the outreach in schools? My children go to Williamson County schools. They're phenomenal schools, but I haven't heard much on substance abuse, cyberbullying, all of the sexting, things of that. I've got an inundation of that stuff, which is very important. Where's the substance abuse outreach to get them before that trauma either takes them over, before trauma comes into play, or before peer relationships, which are so important at that middle school age, take over?
Well, and I sit at the table with Alex at the Williamson County Anti-Drug Coalition. And STARS, they are working more on that and trying to, now it's my understanding that a lot of the grants are the tobacco grants. So some of the grants need to change where the grants become more of the epidemic. And we need to really move into that where we have grants that are doing that. But yeah, the schools, and I think every guidance counselor is equipped because they know how to do it, but it's a hard subject to talk about. Some parents don't want it presented in certain ways, but I would say go to your schools and as the PTAs and ask for those kinds of things.
One last question.
Can you tell us a little bit about the prevalence of the opioid epidemic in Williamson County, and if you could provide us with a website to find statistics on that, and how it's looked over the past 10, 20 years?
The SAMHSA website is probably nationwide, has the best up-to-date stats. Locally here, again, the Tennessee Department of Mental Health and Substance Abuse, I would think, would be one of the best resources for local statistics. They were the one who released the county-by-county statewide fatality rate. That would be my suggestion. I don't know. And then there's other agencies around that are, and I would imagine Alex with the coalition has a lot of that data as well.
I don't know of any websites, but something you could kind of look at it with would be the crime rate. When you look at it in a big circle, if they're not, and I've hit it 4 or 5 times, the money. If these people that are addicted to these opiates can't get it, they're going to break into your house, they're going to break into your car. So Look at it compare with the crime rate too. I know a lot of my interviews that I do, whether it be a theft, a burglary, some robberies, before I even go into the actual elements of the crime, I'll say, tell me about your substance abuse problem. And more times than not, that's what's fueling a bunch of these other crimes, which I'm kind of going to touch my opinion a little bit. If you start legalizing a lot, you're going to have more issues, because even if you're not getting that money, you're going to get it somehow once you become addicted, whether it be stealing from somebody's house you're cleaning, breaking into a car, stealing from the store. It's a cycle, so I would compare your crime rate to.
So do you know if the rate has gone up over the past 10 years? And if so, what kind of?
What are you, like the rate of overdose deaths?
No, just, I mean, I guess if that's the way you measure it.
Or just opioid use?
Yeah.
I mean, yeah. I mean, you look at like 1999 to 2017, like it's just, it's like this.
Okay.
The graphs are up. And you're right, Tennessee, the state of Tennessee Department of Mental Health and Substance Abuse Services has all that information. I can even send it to you if you want my contact information. They send it to me regularly. That's where our grant comes through. So yeah, it's, yeah. In our county, I think in 1999 it was like 5 people died of an overdose, and now it's 25, and that was in 2015, 2016, 17 are just going up every year.
So this is also the state of Tennessee. Speaker Beth Harwell just came out, has a opiate coalition. There's a lot of resources I know because I've recently Googled this topic, and so Beth Harwell just came out, and their report, the coalition or the committee, opiate committee in the state of Tennessee, and then also there's national coalitions and committees that have been in the political arena that are proposing ideas and solutions and that kind of thing. So why we do Frank Talks is to engage the community, to insert the facts and education into the community so we can better dialogue with these current events. Mindy, thank you for attending.
Let's thank the panel, definitely. There are ways to get involved, whether it's with the Williamson County Anti-Drug Coalition. There's a health council here in Williamson County that is extremely concerned about this issue as well as the overall health of our community. And there are, as Cindy mentioned, churches that need to be educated. Our goal today is to get you started talking to each other and with each other and recognizing that an issue like this can change a community's future. And we have a bright future here in Franklin and Williamson County, but we have to take care of each other. Cindy, really, I think you hit that. We have to take care of each other as well. I want to thank Judge Martin and Judge Andre for being here as well as our great speakers. Our next Frank Talks will be October 9th, and we'll be at the Williamson County Enrichment Center. We will have a City Government 101, so you can learn what the mayor does and the city administrator and your alderman. And then we will have a candidate forum for the ward alderman election, which is set for October 24th. Our forum will be on October 9th, and all the candidates have agreed to participate in our forum on that morning at 9 a.m. at the Williamson County Enrichment Center. Again, thank you for being here. Take this information and talk to your friends and neighbors and coworkers. We're very lucky that the City of Franklin tapes these events for us, Frank Talks, and it's been on Facebook Live. You can go and share that on your Facebook page. That shows you're concerned about this in our community. We have to show we're concerned and that we're united in trying to find a solution. So thank you so much, and I hope y'all have a great day.
One more announcement. Tony said that the Narcan up here is, you come by and take a look at it. All police officers have it, and it's available over the counter as well. So that's not a prescribed amount. Thank you.